Well, good afternoon, everyone. Ed Kleeman from the First Responder Center here again on day 4. It's crazy that it's already day 4. We hope you enjoyed not only today, but the rest of the week. Certainly seeing some familiar faces on here from each day. But for anybody who hasn't joined us previously, we'll start with a little bit of discussion, and then if anybody has any questions as we go through the next 20-25 minutes or so, just write it in the chat, and we'll either Lori or I can answer that. I again want to thank FEMA AFG for providing the funding for this week, and certainly our gold sponsor FirstNet, as well as our other exhibitors that made this possible. And again, thank our Behavioral Health Advisory Committee and Lori Jacobs, who's on here, who did all of the legwork, and our presenters as well. Most of the presenters take time off of their busy schedules, to be able to have some of the chiefs that we had on today. It shows the value that they place on, behavioral health. So with that, we're lucky we have Lori Moore Merrill with us today. I thought we kind of start off, it was, we talked about leadership this afternoon, and, really had some leaders of some large departments, in John Sullivan, even with a smaller department with a totally different dynamic. And I thought there was some interesting conversation there about, over the last year, building trust, not only amongst leaders, but also with the troops, if you will, and then, also leaving egos at the door. But I thought it would be interesting, Lori, to talk a little bit about, both, you've been doing it longer than I have, certainly. But, when we talk about advocacy of whether it's behavioral health or cancer at the national level, I think there's a whole nother level of stress and dynamics at play, and probably frustrations for many of us. So I'd love to get your perspective on that, and what kind of keeps you fighting the good fight, if you will.
Yeah, absolutely. Thanks for having me, and thanks everybody for joining us. I know it's late in the day, and so we'll try to keep it as active and poignant as we can. So I think just the stresses and the challenges with national advocacy really deal most, I think, with the competing interests, right? You're always in competition with another interest. And if we think about just in the fire service itself, you've got not only cancer, behavioral health, well, those are competing interests sometimes when we're competing for, limited funds for advocacy or for change in legislation, or, just getting the attention of politicians. You've got, everything from the health and safety perspective to equipment and PPE. I mean, think about how we have even competing interests to get the funding, and what can the funding be allocated for in our AFG grants and our, the fire prevention and safety, all of those things. So we're constantly in this state of competition for a limited pot of dollars. And I think that that's probably the greatest stress. And then I think we have to also address, the politics of the situation. That's always involved at the national level, and often getting their attention. So, just talking about the competition inside the fire service for limited money, then we have to compete with the interest globally for, politicians to even get their attention. And often, unless they have a personal relationship, which we know with all of our very talented, lobbyists inside the fire service, but unless they've either have that personal relationship, or they have experienced something themselves in their families, things like that, it's very difficult to get their attention. And so that's what, to me is the most stressful, is that you are constantly, it's a constant battle, right? We don't get to, rest on your laurels, so to speak, or say, okay, we won that one, let's take a victory lap, because there's always the next battle, right? The next competition, the next grant application, the next proposal, the next white paper. And we have to stay on top of it and passionate about it along the way, Ed. So, those are my thoughts. I could probably just keep going, but let me hand it back to you.
No, I think, you know, there's two interesting dynamics there. One is the politics within the fire service, and certainly I think we're getting ready to enter an interesting time in the next 5 years. If you look at the leadership of the big 7 organizations in the fire service, most of those organizations will have new leaders, if not currently going through a transition right now, but in the next couple of years. And so, you know, there's a whole dynamic there of re-educating people on some things. And then I think the other dynamic that you touched on is the competing of funding, if you will, with other disciplines. And, you know, quite honestly, I think one of the things that hurts us in the fire service is we are by nature, we're going to get it done no matter what. You know, it doesn't matter that we only have 3 people on the engine company. We're going to get it done, even though we should have more. We just have that mentality since day one. And so we're somewhat accepting. And I think that we probably shouldn't be as accepting as we are. And that's hurt us. If you look at, certainly we do work in law enforcement as well. And, you know, if you look at the funding streams available on the law enforcement side for behavioral health, they drastically dwarf what we get in the fire service. And a credit to them, because they need it as well. So it's not like they don't need it. But, you know, I'm interested, you know, you certainly, you know, again, doing a lot of things at the national level. You know, what do you kind of see with the new administration and the things coming down and, you know, possibly getting more funds for the fire service?
Well, I think that as the fire service, let's just talk globally, and you talked about the national organizations. If they can't move the fire service agenda under this administration, you know, that's in the White House, we'll never be able to do it, right? We probably have the most fire friendly, public safety friendly, you know, president sitting in that White House that we've had in, you know, ever, because he knows us and has been an advocate for us in his many seats. So I think that that's something we have going for us, and we've got to leverage that. We also, as you said, there's a lot of leadership change within our own organizations. And so quickly educating, getting them that institutional knowledge and the history, because some are, you know, younger coming into these seats. Now we need that, obviously, the passion, the drive, determination going forward, but making sure that they are abreast of the historical fights. What are the fights that are yet to be had? And knowing the difference, right? What you just said about law enforcement. How many in the fire service knew that we're not getting the same funding as law enforcement? And not that that's needs to be a competition, as you said, they need it as well, but we need to be pressing that fight. So what's making them successful and, you know, dwarfing us in that same battle? What are we not doing? What are we not saying? And so I think that we've got a real opportunity with this administration at the national level to really make some inroads in a lot of our agenda in the fire service to make us, you know, safer, more efficient, more effective. And that's at every level, right? In all of these aspects that we're talking about.
No, and I think you hit on a key point too, and that is you know, the growth of young leaders at the national level. I mean, certainly we see new leaders being developed at the organizational level, but getting people more involved at the national level early on in their career so they can understand the dynamics and understand. I mean, it's you know, there's a lot of great people, and they all deserve to go into retirement and sit on a boat or sit on a beach or do whatever. But there's a lot of institutional knowledge going out the door, you know, in the next couple of years. And so I think it's, you know, really important we do that, continue to build that. And I think that's a great point. Shifting gears a little bit. So, you know, a topic that, you know, we talk about a lot, and I instantly, you know, just go back and forth on this. And this is the pros and cons of technology. You know, certainly, you know, today, you know, and you've talked about, you know, the benefits of, you know, apps and exposure tracking and everything. And then I'm always coming back at you with the, you know, the new EMT or paramedic that's getting FTO'd. And if they could text the patient, they'd have a great conversation, but they can't, and it doesn't necessarily go well. So, maybe share with the group a little bit how we go back and forth on that conversation. And I guess, really, if we think about resilience, and I really am concerned with some of our young folks over the last year that, I mean, they were already on screens too much to begin with, and they've been forced to be on screens even more, unfortunately. How do you see that playing out in the next 10 years?
Wow. How long are we going to be doing this? A few hours now? It's a fantastic question. So first of all, let's just deal with the tech, right? If we just talk about technology in society for right now, and the good, the bad, the ugly. So let's start with the good, right? So tech, absolutely. Does it enhance what we're able to do quickly? Yes. So it's convenient. It's data rich, which always makes me excited. It's information rich. It gives you this instant gratification I look for sometimes, that enhances our speed of innovation for things that we want to do. And that includes advocacy, right? We're much better able to communicate with decision makers even because of technology. But at the same time, what we have to look at the bad side too. And the first and foremost, and you just said it, it's a big time suck, right? In our lives, how much screen time are you doing? And when we say screen time, we used to mean TV. And then it went to laptops, plus TV. And now it is our, the personal devices, your phones, and your tablets and your laptops and your TV. So it's all of it. And we literally function on that, whether you're, ordering groceries or doing FaceTime with family. And so we have now this driven, what is known as, FOMO, if you're familiar with FOMO, fear of missing out. And it drives a mental state in all of us. And we used to, focus in on the millennials with this FOMO. They were the first ones to really exhibit it. And they would spend, this excessive screen time, which we all pointed out and said, don't do that. And now it's all of us. I'm afraid I'm going to miss something. So you're on Facebook continuously, Twitter, Instagram, whatever it is that you are using. And so this fear of missing out is a big driver. And that leads us to these, literal behavior health implications, staying with our main topic here, the behavioral health or mental fatigue. We're losing sleep or a lack of sleep because you won't leave your phone away from the bedside. We have the bad sources of information. And so you talk about driving up, emotional responses. Let's just focus on, talk about the politics for a second. I won't stay here long, but the political, stirring up of emotion just that we saw and was all driven by screen time, during the elections, right? We watched what happened to people mentally from what they were reading on the internet, and it became truth. And we watched it change people's lives and alter relationships that will never be the same. And so technology and its capabilities can literally influence every aspect of our life. And so we have to understand, yes, it has good, but it also is going to affect you as a human, right? Are we going to maintain our human qualities, or are we going to become, we'll call them humanoids, right? Where we are so technology driven that we don't do eye contact. And I talk about this a lot in the generational differences piece, where we talk about eye contact. We've got a whole generation, and there's even more of them coming that are just coming on the job now. This group of Zeds, we'll call them Generation Z, that they don't have any real concept as a group, and obviously there are individuals that will be different, but as a group, about eye contact conversation, right? And if I am on, on a device, yeah, I can do the FaceTime, but if we're in person, I won't even speak to you the same way because I don't have this barrier of technology between us. So it really is affecting our capability to be human. And all of the emotions, communication skills, speaking skills, everything that goes with that. So let me stop talking for a second and see, I know you're thinking.
Oh yeah, well, like, we could do an all day session on this, right? So it's, I think I think it's really interesting when you talk about, um, being human, and the fact that, some, just the driving of technology and continuing, it'll be interesting to see how it evolves.
Mhm.
I think the other thing, and this is not just, the political piece is a great example, but even within just the context of subject matter within the fire service is getting the right information. And, I love for those that have never watched it, I strongly encourage it, the documentary called Social Dilemma. And, you've got some of the people that invented a lot of social media, really talking about that you have to go out and, get multiple sources to form your own opinion. And again, that's not just from a political landscape, it's from the fire service. How many times do we see, even within one department, somebody posts something or pushes something out, and the effects it has, whether it's operationally or emotionally, on employees and members of the organization. So, I think it's a real interesting time when it comes to that.
Yeah, I agree.
One quick question, from your session, the data collected, has the data that you have been collecting ever been challenged by workers' comp or city county risk management, or has the data been invited, is the question.
That's a great question. And so that question is pertaining, for those who might not have seen the session, to the National Fire Operations Reporting System Exposure Tracker mobile app. And so Infor's exposure tracker data, it is your data, by the way, individual download, you maintain your data, but the whole impetus behind the design was to have you have your own database should you ever need it for workers' comp claim. Now, I'll answer that question by saying this. We have literally one of our largest users, and they are working with every department in their scope, is a workers' comp risk pool. They came to us. It's an Arizona municipal risk pool. Came to us and said, look, we are getting a really bad rap for denying firefighter cancer claims. We need help because the firefighters don't understand that they have to show evidence of exposure. So they're filing this claim under presumption, and we're having to deny it first because we just need more information. But I can't just go ask them for more information. I have to deny the claim and then ask for more information and have them refile it. See, those are the rules. They can't do anything about that. And so as a risk pool, longer term, because their insurances that they represent, all of that, right? So all of this is a quagmire of rules. But at the end of the day, they said if a firefighter could print out, their exposure list, whatever it is, whether it's carcinogen or bloodborne pathogen, or, now COVID was a big one, or even the traumatic events that they have experienced, attach that to their claim, now we'll be able to process, right? And so that's when they came to us and said, what do you have? Can you help us? So I will say to you, have we had a claim filed yet with somebody actually using their Infor's data? Not that I am aware. We're still relatively new, and a lot of our users are, younger because of the mobile app. And so we're trying to really penetrate the fire service. And if anybody knows of anybody who's actually filed their claim using their data and having it so readily available, we'd love to know. But I will, like I said, I'll answer the question by saying the risk pools are coming to us to encourage firefighters under their scope to use this app, because they know they have to have evidence to process your claim. Now, that's going to vary by state, but your state laws, make sure you know what it says, because the majority of them do, in fact, require evidence of exposure for filing your claim. Some of you may know, Ed, I'm sorry, I'm going to just take another tangent here, but some of you may know, times when you've had everybody on this session probably has somebody they know with cancer in the fire service, right? And so filing a claim, you could probably tell war stories about having to go back through old paper logbooks and finding the calls they went on, or having to look back in your incident data, and maybe you're trying to figure out, okay, what day did they work? What shift were they on? Were they on that day? Okay, that unit made a call. Literally having to go hand pick this data to file their claim. And and when I was at the IFF, this happened constantly. We got these calls daily from wives, from chiefs, from spouses. So that's why this app was created, is for that very reason.
I think in a few minutes ago, you mentioned that the insurance company came to you, right?
Mm-hmm.
I think that's a positive sign, that they're not looking, it's not that they want to deny it. It's that, to your point, it's the rules. How do you think this comes up and it, whether, on presumption across the board, and, how do we do a better job of engaging the insurance companies at the national level to help get them on board?
Wow, that's a great question. So one of the paths that we've tried to take, and we are still on that path, is to learn a lesson from this risk pool. This is just one risk pool. And so there are multiple, in that particular state. We've also contacted, there's a national consortium of, risk pools that workers' comp groups, that come together at a national level. So we're trying to pursue that, just to get them aware that this exists, and that we want to be an advocate for firefighters tracking their exposures. And so I think that that's where we're going to have to work from the ground up until we can get a national national attention, and it trickles down, because most of these risk pools are controlled at either municipal or state level. So there's not like one national effort that will flip a switch and make this so.
What another question related to the risk pool in the chat, related to EMS personnel. Do you have a fair amount of data on EMS personnel?
We do. EMS, firefighters, EMS, we even have a lot of law enforcement that are using the app because they don't have anything like this. And we're still looking for grant funding to be able to create this, for law enforcement, rebrand it, change up some of the questions, obviously. But yes, we do have a lot of, and of course, a lot of firefighters are EMS people as well. So anybody in North America can download and use the app for free. It is there for you. And the EMS, a lot of EMS people. And there are 5 modules. There's the fire module that primarily tracks carcinogens. There is a EMS module, and also COVID is in the EMS module. There is hazmat. There is a tech rescue module that's very simple. And then we have the behavioral health module, of course. And so those are there for you. Anybody, as I said, can download and use it for free. It's in both app stores, iOS and Android. And the difference is, you can use the app. You'll have to enter an incident number and an address on each of your calls, because there has to be some verification or validation that there was an actual call that took place. So when you download the app, and you can do it now, just search for NFORS, NFORS, in the app stores. Download the app. It will ask you for an incident access code. Just bypass that, because if your department is not connected to our NFORS analytics piece, then you don't need that incident access code. So just bypass it, go ahead and use it for free. If you are interested in getting that automatic download for your department, which automatically populates all of your incident data every time you go on a call, then that's a different conversation that I'd love to be able to talk with you about. So reach out to us and we'll talk that through.
How do you think, going back to the presumption piece, obviously there's a lot of states that claim they have presumption, more so on the cancer front, obviously increasing on the behavioral health front. But in many cases, we know that it's really presumption in name only. It's not effective. It's virtually impossible for somebody to navigate the system. I would say, and tell me if you agree or disagree, I think certainly on the cancer front, that's improving. It's all about advocacy at the state level. But how do you see us going forward on the behavioral health side in the next couple of years?
That's a great question. So we have got to, I think it's twofold. We've got to continue to reduce the stigma for our own people, right? For responders, continuing to ask each other, are you okay? You know, are you thinking about killing yourself? I mean, those hard questions that we've got to pay attention to each other. So reducing the stigma and making sure that we're staying on that path. We all know that it's real. If you haven't experienced it, you're not being truthful to yourself. And so that's one thing. So we've got to keep it at the forefront of our industry. The other thing is that we have got to make sure that we are raising it as an issue outside our industry, right? So it's reducing the stigma means we can talk about it, but raising the interest is a whole other situation. Getting the interest of decision makers, we've got to be able to advocate for that. And often that means that we do it with our public safety partners, like law enforcement. Often it means that we move forward together to get the attention to be able to get these resources. So, you know, we have to focus on both of those dynamics, not just one or the other. And I think that the other thing we've got to do is pay attention to continuing to advocate for diagnosis codes, because one of the biggest issues is that we have you've got a burden of proof to even be diagnosed, right? So showing that you've had an exposure to a traumatic event, even be diagnosed with PTSD. And so those diagnosis codes are difficult. Getting general healthcare coverage because of that is difficult. And so then that just leads to increased difficulty, you know, the barrier getting that presumption. So those are all things that are dynamics at play here. And we've really got to stay, you know, on the forefront of all of those. So different levels, but they are all connected somehow. And so we're doing well with the benefit coverage. I think we've got some momentum going there. We still are slow on the presumptive battle. So, and presumptive battle that doesn't require, like you said, jumping through, you know, 80 hoops to actually confirm that you've got a diagnosis that needs coverage. So without, in particular, you know, I'm sorry, I'm going to take a tangent, but the secondary, you know, it's you get the drug and the alcohol rehab, but it's secondary to PTSD, which we find out after you're in, right? And so these are the kinds of dynamics that we have to continue to sort in our rehab facilities as well, and making sure that our clinicians know what they're doing, know what they're talking about when they report out on the number of cases, so we have real data to carry forward. I'm always going to come back to data, you know that. We have real data to carry forward to make our case.
No, well, good. Well, listen, we're about out of time for today. Lori, I really appreciate you know, you coming and jumping on at the end of the day in your session earlier today, as always. A lot of great information there. You know, we'll make sure that in the information that goes out, we include the information on the app, as we're getting a number of questions about that. But so again, thank you for being here today and all the work that you can continue to do at the national level. And thank everybody that made it to the end of the fourth day. You know, if we were in person, a lot of you would have been on your earlier flight already and out of here, you know. So, but, you know, it's great to see how many people. You know, we hope to see everybody in person at a conference next year, later in the year. And just to mention, on the cancer front, we do have our Cancer Symposium June 10th through 12th in Orlando. For those of you that on the health and wellness side are involved in cancer initiatives, that's a hybrid event, so you can go to our website and check that out. But again, thanks to everyone. Please remember to do the surveys. If you fill out the survey, you can have access to the presentations. And we look forward to seeing everybody soon in person instead of at our virtual happy hour. So I would like to, one last thing, and before I forget, I do want one last thing. You know, obviously, we had a number of presenters today that are in the military or have served in the military. Just a reminder of Memorial Day this weekend. Please don't forget all of those that have served our country and lost their lives on our behalf. So thank you very much, and have a great weekend.